So another topic that women come to us very often with is irregular menstrual bleeding. So what is the difference between regular and irregular menstrual bleeding? So for a woman, for her to get her cycles regularly, an egg must grow and rupture on time, and based on that the endometrial lining grows and sheds every month. So that a normal cycle is usually between about 25 to 35 days. Any period that comes either earlier than 25 days or is delayed beyond 35 days is called an irregular cycle. So this also means that any bleeding that happens between two periods as well comes under irregular bleeding. So what are the common causes behind irregular bleeding? It can either be because of hormonal imbalances, it can be due to thyroid conditions where a woman may be hypothyroid or hyperthyroid. That can cause a hormonal imbalance and that can affect her periods. It can happen because of conditions such as polyps, which are fleshy growths inside the uterus, or it can also happen because of fibroids, which are in the mouth of the uterus, and this can cause either irregular bleeding and can be associated with heavy menstrual bleeding as well. So how can you pick up these conditions such as fibroids or a polyp which is in the uterus and causing irregular cycles? Normally they are picked up by doing an ultrasound. Very commonly what is done is a 2D ultrasound, but now technology has advanced in such a way that you can also add on 3D ultrasound along with something what we call as a sonohystogram, where we push in a little bit of fluid inside the uterus and we can see these polyps and fibroids very nicely, which are inside the mouth of the uterus as well, and we can identify the number, the size and what exactly is happening there, and based on that we can go forward with treatment options. And what are the treatment options available for this? Polyps and fibroids which are inside the mouth of the uterus can be treated by a procedure called hysteroscopy, where it is done as a day procedure. You can come in the morning, get admitted, we give very mild sedation and we put in a scope inside the uterus through the vagina. We can remove these polyps and fibroids in a single sitting itself, and you can go home the same day.